What are the 7 stages of Lewy body dementia? Lewy body dementia, LBD, is a progressive form of dementia that affects people over the age of 55. It is characterized by changes in thinking, behavior, and movement, and is one of the most common forms of dementia. According to the Lewy Body Dementia Association, the disease is estimated to affect more than 1.3 million Americans. The term Lewy body was first used in 1912 by Frederick Lewy, after he noticed an abnormal protein buildup within nerve cells in the brains of people with Parkinson's disease. In 1996, a consensus conference including neurologists, psychiatrists, and pathologists increased the diagnostic criteria for Lewy body dementia, and from then on, this form of dementia has been viewed as a distinct disorder. People with LBD experience memory loss, as well as changes in mood, alertness, and thinking abilities. The disease can also cause difficulty in controlling coordinating movements, reduced movement speed, and rigidity. Additionally, hallucinations, delusions, and changes in personality are sometimes present. The course of LBD is typically divided into 7 stages, each with their own set of symptoms. This guide will go into detail about each stage so that you can better understand what to expect as the disease progresses. We will also explore strategies for managing symptoms, as well as the support available for those living with LBD. The 7 stages of LBD are pre-dementia, mild cognitive impairment, MCI, dementia, moderately severe dementia, and end-stage dementia. Each stage is distinguished by level of cognitive and functional decline, along with unique physical, psychological, and behavioral symptoms. As the disease progresses, it can become increasingly difficult for those living with LBD to care for themselves, often requiring someone else to provide support and assistance. Pre-dementia. During this stage, individuals may experience subtle signs and symptoms of cognitive decline, such as memory loss, difficulty concentrating, and changes in mood and behavior. The changes can be subtle and vary from person to person. Mild cognitive impairment, MCI. This is considered a transitional stage between pre-dementia and dementia. During this stage, there may be additional cognitive issues along with visual hallucinations, impaired motor function, and difficulty interacting with others. Dementia. This is a typically detrimental stage characterized by significant and increasing cognitive impairment. Individuals may experience difficulty with speech, motor skills, hallucinations, and anxiety. Moderate dementia. During this stage, individuals may experience confusion, agitation, memory issues, as well as delusions and hallucinations. In addition, activities of daily living may become increasingly difficult. Moderately severe dementia. During this stage, cognitive impairment becomes more pronounced, marked by noticeable confusion and disorientation. Individuals may also experience psychosocial issues such as depression. Severe dementia. At this stage, individuals may need extensive assistance with basic activities such as eating, dressing, and using the bathroom. Additionally, they may experience severe confusion, aggression, delusions, or hallucinations. End-stage dementia. This is the last and most advanced stage of LBD. During this stage, individuals may experience a decrease in communication, activity, and mobility. They may become bedridden or require 24 hours of nursing care. Additionally, some may suffer from incontinence, seizures, and other medical conditions. By recognizing and understanding the stages of LBD, it can be easier to diagnose and treat the condition. It is important to have an open dialogue with your doctor to discuss the best treatment approach for your individual needs. Caregiver stories. Caregivers of those living with Lewy body dementia play an integral role in providing care and support. They witness firsthand some of the struggles and triumphs of patients as they navigate through the different stages of the disease. A few common sentiments expressed by caregivers include a feeling of isolation because of the unpredictable and progressive nature of the disease. It can be emotionally and physically taxing for caregivers as their only job is to watch and manage the conditions of their loved one. It's also important to recognize the feelings of emotional exhaustion, guilt, and a fear of the unknown that caregivers experience while caring for someone with Lewy body dementia. As the disease progresses, caregivers may even find themselves struggling to cope with the changing dynamics in their relationship with the patient. Despite all the difficulties they encounter, many caregivers remain strong and resilient throughout the process. There are several types of support available for people with LBD, including medical professionals, medication, therapy, and support groups. Medical professionals, such as neurologists and geriatricians, can help diagnose and treat LBD. They can also recommend medications that can improve brain function and reduce symptoms. Additionally, they can provide advice and support on managing any complications associated with the disease. Therapy can also help improve quality of life for those with LBD. This includes physical, occupational, and speech therapy. Physical therapy can help with mobility issues, while occupational therapy helps with everyday activities. Speech therapy can help restore communication skills which can be impaired by LBD. Support groups provide a forum for people with LBD to share their experiences, learn from each other, receive emotional support, and gain insight into new treatments or therapies. Many communities around the world have support groups specifically for LBD. Finally, there are a variety of online resources where people can access information on LBD and connect with others in the same situation. These include blogs, forums, and websites devoted to helping those with LBD. Overall, there are many options for support when living with LBD. With early diagnosis, proper medical care, and the right support system, people with LBD can still lead fulfilling lives. Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.